Do you need help with your OET speaking? In this video, we're going to look at intelligibility from the OET speaking criteria and how you can improve in this area. So keep watching. Hello, it's Jo here from SLC, here to help you pass your OET exam. In this video, we're going to take a look at intelligibility from the speaking criteria. We will show you how to score highly in this area. We're going to look at what the descriptors actually mean and how you can improve. Let's check it out. So basically, intelligibility means the ability to produce comprehensible speech. So this means that your pronunciation is easily understood, stress, rhythm and intonation are used effectively, and that your accent doesn't have a negative effect on the listener. So how can you improve in this area? Let's take a look at what the examiner is looking for when you do your OET speaking roleplay. It's really important that you pronounce words very clearly, especially vowel sounds, final consonants, and also use the correct word stress. For example, the vowel sound air in carefully or I in dialysis. And for consonants, the r in right or the w in womb. And notice the stress in these words. Uncomfortable, sciatica. Pitch and project your voice well, so no mumbling, slurring speech or fading out at the end of your sentences. Notice the negative effect of mumbling and fading out in this sentence.
It's important that you complete the course of antibiotics for the full 10 days, okay?
Now notice the clarity in this example.
It's important that you complete the course of antibiotics for the full 10 days, okay?
Focus on your intonation and the word stress to emphasize meaning. Listen to this sentence and notice the stress words and the rising intonation at the end. It's really important that you remember to take the medication after eating. Is that all right? Let's check out some practical activities that you can do to improve your pronunciation. Keep an organized vocabulary notebook. Write down difficult medical terms with pronunciation in a system that works for you phonetically. For example, sciatica. You can use online dictionaries with sound files to repeat and practice making the sounds. Macmillan, Oxford and Cambridge dictionaries are good for this. And ask people to correct your pronunciation while at work or out socially in English, for example, colleagues, patients and friends in healthcare. Make a list of the kind of sounds that you find difficult to pronounce, for example, the l and r. So for example, lice and rice, or the I and E, ship or sheep. Then practice and get feedback if you can. Another thing the assessors will be looking out for is voice projection and pitch. Remember, they don't receive a video, only a sound file, so it's vital that your speech is clear. Things to remember are speaking at a good volume level. Remember, your test is recorded and should be clear. Practice recording yourself on your phone and play it back to see if your voice is loud enough and clear. Some people have very deep voices and others are higher pitched. What matters is that you vary your pitch, rising and falling as you speak. Listen to the range of pitch in sentences by watching online videos of consultations and copy the way they speak. You can also use voice recordings of yourself to check that you're not mumbling, so speaking like this, or slurring your speech. If your sentences are mumbled or fade out, you will not seem confident to the assessor. Compare your recording with online videos and notice areas where you specifically need to improve. Then record yourself again and see if you do better. So copy, record, compare and repeat. Now let's take a look at intonation and word stress. So your intonation should help enhance meaning, such as rising intonation at the end of your questions, expecting yes or no answers. For example, would you be able to manage that? Is that okay? Practice your word stress to draw attention to the important part of your advice. For example, it's so important that you keep taking your medication twice daily, Mrs. Brown. Listen to intonation by watching videos of medical consultations. Note how it varies to help understanding. You can also watch and repeat the intonation in question forms. Listen and note how medical professionals use a softer tone of voice when expressing empathy and a firmer tone of voice when stressing to a reluctant patient that they should do something. For example, I can appreciate how difficult this might be for you, soft tone. But I must stress how important it is for you to cut down your weekly alcohol intake, firm tone. Let's talk about accent. Some of my students worry that their accent will cause strain for the listener. It's okay to have an accent. In fact, I think it's part of your personality, but it should be understandable to the listener. One way to improve is to ensure that your rhythm is not uneven. Listen to the natural rhythm of native English speakers by watching medical video clips, podcasts, and things like that. Try and imitate the rhythm in your speech. Your native language may have a very different rhythm, so a lot of listening and repeating phrases can help with this. You also might want to check that your accent is intelligible by asking an English teacher, a colleague, or a friend to give you feedback. In our modern times, we have world English, and there's no need to reproduce a perfect English accent. As long as your accent doesn't cause strain for the listener, it's absolutely fine. Top tips for intelligibility. Practice speaking clearly. It's important to focus on sounds that are difficult specifically for you in your study time. Think about copying intonation and rhythm from audios and videos. And don't forget, it's really useful to record, review, and repeat to improve. So thanks for watching. Don't forget to subscribe for more videos like this. Hit the bell so you're notified every time we post a video. We've got loads of great videos coming up on the speaking criteria. Don't forget to check out our website and see how we can help you prepare for the OET exam. See you next week. Bye! In this video, we're going to look at the speaking criterion of intelligibility. Do you need help with your OET? Do you need help? In this video, we're going to look at one of the speaking criterions. That'll do. Well, it basically means the ability. Let's check it. Oh my god! That never happened.